Yes, thank you. Well, I think that Cynthia has just presented a very interesting approach on quality and performance assessment for multimorbidity care as has been developed in the US. And I think that in particular the guiding principles that she presented could be very useful for us here in European countries too. To develop performance and quality measurements at system level, but also for care providers who want to evaluate their quality improvement initiatives at the local level. Now, what I like to talk about, a few words about the developments in multimorbidity care in European countries, as I've seen it from the iCare4EU project that I was involved in. And then also a few words about performance and quality assessment in addition to what Cynthia has said about it. And I'd like to address what to assess, but also what has been assessed and has been found, just to give you a short impression of the state of the art and then some lessons learned. Okay. The right thing. Find the right thing. It's indicated with an arrow. Okay, about the iCare4EU project. It was a project that ran in 2013 until 2016. So the data were collected in 2014 and 15, and that is something you have to keep in mind. The aim was to identify innovative approaches for multimorbidity care in European countries, in 31 European countries, study these approaches and then come up with recommendations for policy and practice. Now this is a very brief overview of the key findings. Actually, we worked with country experts in these 31 countries, and one of the first things that we asked them was whether they could provide us with information about the policies and strategies that they were available at the national or regional level with a specific focus on multimorbidity care, multimorbidity management or prevention of and management of multimorbidity. And well, it turned out that there were hardly any such policies and strategies. Many countries had chronic illness care policies. They had disease-specific strategies, for instance, on diabetes and so on. But these lacked the multimorbidity focus. There were countries, I think, 3 countries that had already done developmental work at the policy at this level at that time, but there were few. In many countries, there were also developments of policies on integrated care. But there we saw that the focus was mostly on care for older persons and especially early identification and also management of frailty. And well, we have heard this morning there's a lot of overlap, but there's still also there are differences. And I think that the challenges in multimorbidity management are partly different from that in frailty, and that's also true for the target population. Now, despite the fact that there were so little policies, we found actually quite a number of innovative approaches at a local or regional level where people were trying to improve the care that they provided to the persons with multiple chronic conditions. And they were mostly initiated bottom up. And I remember that there was a program manager, and he explained about this integrated care practice, that it was despite the current level, the current health system, instead of thanks to the current health system, that this integrated care practice for multimorbidity had developed. Now, what struck me most was that all these practices, they lacked information actually whether they were achieving the results that they were striving for. because there were so little evaluations done, and especially there were hardly any outcome evaluations done. And so this led us to conclude then that despite numerous initiatives, conclusive evidence on the effectiveness of strategies to improve care for multimorbidity persons is scarce, and by the absence of evaluation, policymakers cannot be provided with guidance on effective models of integrated care. So I agree with this program manager that practice needs policy, needs support from policy. But it's also the other way around, that, that I think that policy needs practice. They need evidence from practice to further develop policy and practice. Okay, a few words now about performance and quality assessment, actually based on what Cynthia has said, but also based on the work of many others who are present here today. About what to assess, I had a look on it, and I tried to reorganize it a bit according to the triple aim framework, because I think that that framework shows the value that health services could have for this population. And so I combined outcome areas that have been prioritized based on several studies that are mentioned here below, and I combined them and restructured them. So then you have some idea of what important outcome areas are in multimorbidity care. But this is still a long list, and I think it's important that you select outcomes, that you are selective to prevent measurement burden, of course. And this should depend on the objectives of the study, whether it is an evaluation of a quality improvement trajectory at a local level, or whether it is whether it's a system reform that you want to evaluate and monitor. I think I'm going to, yes, that's why I'm going to skip some slides. I wanted to say something about what has been assessed and what has been found to give you an impression, and I think I can combine these. So here you see, with regard to the patient experience of care, this is based on studies that had been reported in the systematic reviews mentioned there below, but I only selected the studies where the interventions, that were organizational interventions, were focusing on people with multimorbidity, so with 2 or more chronic conditions, regardless of the disease type. So not these, well, let's say comorbidity studies. And as you can see, in 6 studies, there were, they assessed the patient experience regarding the care delivery process. And here you see that, well, the results are actually quite positive in these evaluation studies. There were more who also assessed patient involvement or patient engagement, but then it was part of the measures that were already mentioned under care delivery process. That is something I need to add. And what I think is important, that treatment burden was not assessed in any of these studies. Well, I think it is an important outcome area in multimorbidity care. Health outcomes, here the results are a bit more mixed. Usually health-related quality of life and self-rated health measures are being included in the studies. And you see that there are studies that show positive effects of organizational interventions to improve the care for people with multimorbidity, but not all. And finally, the cost domain. The use of services. None of the studies showed decreases in the number of visits or consultations with medical specialists or general practitioners, which I think is not very surprising, because this target population has high needs for care and support. So it's more interesting to look at hospital admissions, and especially readmissions and also ED visits. And there you see that there are some studies that show positive effects, but also several that do not. Lessons learned. Practice needs policy, but policy also needs practice, and that's why I think it's so important that we evaluate also the quality improvement initiatives that we are implementing today in our countries. Performance and quality assessment should include the patient voice. Now, this sounds so obvious, and I often hear that this patient voice is highly relevant, but then it is not assessed. And often reasons are, it is complicated, it takes time, we need ethical approval, we don't know whether patients are willing to participate, why bother them more, because then they already have so much to bother. And I simply think that you cannot assess the quality of multimorbidity care without involving the patients who should benefit most. Value the patient experience besides the outcomes. I think that we have shown, these studies show that you can see that, patients really could experience that they receive better care, and most of our evaluation studies do cover only a limited number of years. So it is not always feasible to say that outcomes should change in such a short time. But patient experiences are very important, should be valued in itself. But then we need to do more developmental work. I'm aware that there are many developments, but I still think that there's a lot to be done when it comes to the development of patient-reported measures. Thank you.